Welcome back to Wake Up Charlotte Weekend. October, of course, is Breast Cancer Awareness Month, and 1 in 8 American women will be diagnosed with the disease in their lifetime. It is second only to lung cancer as a leading cause of cancer deaths among women. There are also a few common myths that could at times give you a false sense of security. Joining us now to help sift through what's fact and fiction is Novant Health breast surgical oncologist Dr. Lori Gentile. Dr. Gentile, thank you so much for joining us again this morning.
Thank you so much for having me.
So many people think of breast cancer as something you'd be diagnosed with when you're older, but we all know someone who has been touched by this. So what factor does age really play?
So that's a very good question. And the risk of breast cancer definitely increases as we age and in older women. However, there's a significant number of women under the age of 50 that are impacted regularly. In the United States, about 1 in 69 women diagnosed with breast cancer are actually in their 40s. And then about 15,000 women a year under the age of 40 will actually be diagnosed with breast cancer as well. So it's really important for women at these younger ages to pay attention to their breasts and changes to their breasts. And then when they see or feel something that's different for them, to notify their doctor.
And like you just mentioned, we are all trained and told to do those self-checks, but is a lump the only indication of breast cancer?
So interestingly, the vast majority of breast cancer these days, because screening mammograms are so prevalent, are diagnosed with screening mammograms or an abnormality that's been detected. And for those women, the breasts are completely normal on the outside. They don't have a sign or symptom that there is breast cancer there. And that's a good thing because we're finding breast cancer at a very early stage at that point. Breast cancer can be diagnosed with signs and symptoms, and a lump is a common symptom, but there are also symptoms that women may feel in addition to a lump or instead of a lump, which would be changes to the skin, thickening of the skin, changes to the nipple or nipple inversion, rashes to the skin, or swelling of the breast. So if any of those things ever arise in a woman, those would be signs that they would want to meet with their doctor or primary care physician to get that checked out.
And so we're used to filling out our family history at the doctor's office, but does that play a role, family history?
So it's a common myth, like you said, that you have to have a family history to get breast cancer. But in fact, as you mentioned, breast cancer is just very common among women in general, 1 in 8. And 90% of breast cancer is what we call sporadic, meaning that it just happens. About 10% of the time, we find that women with breast cancer do have a genetic mutation that caused or contributed to the breast cancer. And oftentimes these women do have very strong family histories of breast cancer to go along with that. Family history is important, but it's one of many, many risk factors for women to consider when they think about their chances for getting a breast cancer over a lifetime. And so I oftentimes will tell women breast cancer is like a 1,000-piece puzzle, and we know some of these pieces, and that includes family history as one of a piece of a puzzle. But there are many, many risk factors for breast cancer in addition to that.
All right, Dr. Lori Gentile, thank you so much for being here with us this morning and sharing this important information.
Thank you. I appreciate it. Have a great day.